Dr. Roy and Katie, say hello to Valder.
Hi,
Hi.
Valder. How are you?
I am fine, Dr. Roy Asim, and you brought a friend, Katie. Thank you for being here, both of you, on the Valder BB Show live out of Dallas, Texas. How are you both today?
Excellent. Thank you for having us.
Pretty good.
Okay. Dr. Roy, I'm going to start with you because you're going to give us an understanding of what narcolepsy is and its symptoms. So what is narcolepsy? We throw that word around, but most of us don't know what that means.
Yeah, no, I appreciate that question. So, it's a 24/7 problem, and that's really important to understand. It's a chronic neurologic condition. It affects 1 in 2,000 Americans, and the number one symptom they're dealing with is daytime sleepiness, fatigue, tiredness, and no matter how much sleep they get, they still feel tired. And another symptom that's not with every patient with narcolepsy is cataplexy. And this is kind of unique in the sense that it's emotion that triggers a weakness in the body. So laughing, joking, anger will bring on this weakness, and it may be in the knees, it may be in the arms, in the face, and some people even collapse to the ground.
I've never heard that symptom before. I've heard of the sleepiness. That's very informative. And if you don't mind, let me ask Katie. Katie, I think you can give us a window into how narcolepsy impacts your life.
Absolutely. My narcolepsy symptoms started my senior year of high school when I should have been reveling in the years of hard work I had been doing and getting good grades, competitive robotics. I played 3 instruments at the time. I was a very busy kid. And instead of enjoying all of these things that I had come to love over the years, I put them on the back burner. They became unimportant when compared to how much I needed to sleep. It became the biggest part of my life, and I would put off most anything if it meant getting 5 more minutes of sleep in the morning.
That's incredible. And so you knew something had changed in your life, I'm going to ask?
Oh, I absolutely did. It's a matter of I still enjoyed these things and they still mattered to me. I just didn't have the energy. I was too tired to go and do these things. And so I figured there had to be a reason. Because I still cared, I just couldn't.
Thank you so much for sharing from your intimate life. I'm going to go to Dr. Roy now. Dr. Roy, is that normal for a person to experience narcolepsy the way Katie has described to us, or is her condition unique?
Yeah, no, this is common, and luckily Katie sought help early. I think many people in her shoes would push this off and just blame either the school or lifestyle or kids or whatever on why they feel tired and accept the way they feel. And she went and went on to get evaluated.
With technology changing medicine, I see right before my eyes. What are you seeing new ways to manage narcolepsy or current ways to manage it?
Yeah, great question. And it's an exciting time in the space from a physician perspective. There's so many options. There's non-medication approaches, which, good sleep habits, keeping a regular routine, minimizing caffeine. But for narcolepsy, those lifestyle things don't always help enough. And so we end up relying on medications a lot more. And luckily, we have a lot of options today, of which one of them is a medicine called Lumryz, which is a once nightly bedtime sodium oxybate medication made by a company called Avadel. And just with full transparency, Avadel is compensating for our time today. But this medicine helps daytime sleepiness, it helps the cataplexy, but it does have a box warning. It is a CNS depressant. It has some potential side effects with nausea, vomiting, dizziness, headache, and even bedwetting. So it's not necessarily appropriate for everyone. So you should talk to your doctor to see if this is the right choice for you.
When people are living today, people I see on the news where they have 2 and 3 jobs, they've got kids, they've got family, and they think they might have narcolepsy, but they may be just overstressed. Where do we go and get an understanding of stress and narcolepsy?
Yeah, great question. At the end of the day, talking to your healthcare provider and being an advocate for yourself to figure out, is this due to just how much work I'm doing, how much stress I have, or is this beyond what I should expect from the lifestyle I'm living? And again, each person's different, and it's important to just take that as an advice to go seek out an expert to help you understand if that's a problem. And if you want to learn more, there's a great website, lumryz.com, LUMRYZ.com, that has great information on this neurologic condition and treatments.
Well, I'm sorry I didn't get to talk to Katie more, but you guys gave us some great information and some great inspiration. Dr. Roy and Katie, thank you so much for talking about narcolepsy. It's something I think needs to be talked about a lot more because I think it's very prevalent in our society, but you don't know if you don't go to the doctor. Thank you so much, guys, for being my guest on the Valder Beebe Show.
Thank you for having us.
Hi, I'm Valder Beebe, host of The Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/Valder Beebe Show. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/Valder Beebe Show and stay connected as I interview the world's most fascinating people.